Thank you so much for joining us today. This is the Aligned Modern Health Digital Doc Conversation on Women's Health. We are joined by two experts in their field, Dr. Elise, functional medicine physician, and Drenna Black, licensed acupuncturist. Before we get started hearing from our expert providers, we just wanted to give you a little bit of information about Aligned Modern Health in case this is your first time joining us. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider. We really aim to get to the root cause of why you're feeling what you're feeling and not just focus on any one siloed symptom or condition. In each of our 18 clinics throughout the Chicagoland area, we feature several core services. Our clinics are supported by a physical medicine practice that includes chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. Our clinics are also supported by an acupuncture practice. Acupuncture is really great to benefit physical pain symptoms, but also can be really amazing for some more intangible kinds of concerns like stress, anxiety, depression, sleeplessness, fatigue, seasonal allergies, men's and women's health and hormone balancing, fertility support. We also offer several other modalities within the traditional Chinese medicine umbrella like herbal medicine, cupping, and moxibustion. Aligned Modern Health rounds out our services with our functional medicine and clinical nutrition practice. And we like to say this is a really great way to look internally as to why you're feeling what you're feeling externally. We treat a lot of gastrointestinal and autoimmune concerns, bloating, constipation, fatigue, migraines, hormone balancings. We offer food sensitivity testing, weight management programs, and nutritional counseling support. We're here for you and happy to help. With that said, I'd like to turn this conversation over to our expert providers, and I would first like to welcome Dr. Elise Todd.
Thanks so much, Jane. Hi, everybody. Thanks for joining us today. My name is Dr. Elise Todd. I'm the functional medicine physician out of the Andersonville and Vernon Hills clinics. My doctorate of chiropractic degree is from National University of Health Sciences in Lombard, and then my Bachelor of Science in Kinesiology is from University of Illinois, Chicago. Basically, the way that I practice is I try to empower patients and educate them so they can take an active role in their own health and allow them to help them to remove obstacles, allowing the body to heal itself.
Wonderful. Thank you so much for joining us. Next, I'd like to welcome Drenna Black, licensed acupuncturist.
Thank you, Janine. Good afternoon, everybody. I am Drenna Black. I'm the licensed acupuncturist at Vernon Hills. I received my Bachelor of Science from Midwest College of Oriental Medicine and a Master's of Science in Traditional Chinese Medicine and Nutrition, as well as my undergrad degree as a Bachelor of Science in Integrative Therapeutic Practices from Metropolitan State University in Denver. My passions as an acupuncturist include definitely treating women's health concerns, gastrointestinal issues, anxiety, stress. I do a lot of work with fertility, physical pain, as well as treating chronic fatigue symptoms.
Thank you so much. It is my pleasure to now turn this conversation over to you as you give us a little bit of information about some women's health topics.
Perfect. All right. So what we were thinking we would do is Drenna and I would start off with how we both approach treatment, especially of women's health issues. And then we plan on talking about, we have about 5 most common things that we see as far as women's health goes in our practices, and then kind of give you some snippets as to how we would go about treating them. Drenna, you want to get us started?
Yes, I'd love to. So over the past few years practicing as an acupuncturist, I've definitely encountered many women who are seeking optimal health. And traditional Chinese medicine is very unique in that we have the opportunity to look closely at the body as a whole. During your initial intake as an acupuncturist, I ask many questions in regards to our whole health system. So we cover diet, digestion, quantity and quality of sleep, We talk about menstrual cycles, pain patterns in the body, temperatures, body temperatures during day and night, cravings, whether or not we're suffering from night sweats, incontinence, chest issues, pain, tightness, lifestyle habits, as well as our emotions. And today I would like to, I'm looking forward to chatting with you all about some of the most common things that we see, such as PCOS and excessive bleeding during our menstrual cycle, pain during our menstrual cycle, IVF and IUI, and a few other things. So why don't we go ahead and start it off with some PCOS talk.
Okay, sounds good. So PCOS, right? I would say probably one of the most common things that comes into both of our offices, right?
Yeah, definitely.
Yeah. So PCOS. Functional medicine looks at the body a little bit differently, not only for PCOS, but for all the other women's health issues and everything else out there. The way that functional medicine looks at the body, we start also with a very thorough intake, like acupuncture does. Talk about past medical history, talk about current symptoms, what our patients' periods are like, what their digestion is like, their diet, sleep, stress, energy, medications, supplements, things like that. From there, blood work and specialty testing is at our disposal. So checking to see different nutrient imbalances, see if there's inflammation, any sort of blood sugar dysregulation, anything that maybe is even kind of like under the radar, because functional medicine, we interpret blood work a little bit differently than our colleagues as MDs or DOs do. And then from there, what we do is try to balance any sort of nutrient deficiencies, bring blood sugar back into balance, and then nutrition is a very big part, as well as different herbs are a very big part of functional medicine practice. So PCOS, so that's, like I said, a really big one. That one, at least in functional medicine, the big things that we're looking at there are iodine deficiency. More research has found that an iodine deficiency can cause cysts in different organs of the body, most prominently ovaries and thyroid, which I don't think it's any coincidence that both of those organs are implicated in PCOS. Definitely look at blood sugar, see how the thyroid is functioning. Take a look and talk a little bit more about, are the periods regular? Are they happening at all? And it's a very individualized approach, because PCOS is such a large conglomeration of symptoms that no two people are going to be the same. So that's a little bit about how functional medicine takes a look at it. Jenna, and this is something I would definitely refer to Jenna for, just because acupuncture looks at the body a little bit differently.
Yeah, in terms of how we would approach PCOS, which is polycystic ovarian syndrome, a lot of times as a practitioner, I'll find that the body is overtaken by a condition that we would call dampness, or an excess of damp. So in majority of the cases that I've worked with, we really look at the diet from an Eastern medicine perspective, and what foods could be causing the dampness to accumulate in the body, what foods can be causing the cycle to not be regulated. It's a little bit different than Western nutrition, where they would look at nutrients and fats and protein and this type of thing. But with Chinese medicine, we look at almost like what does the food look like, and what does it resemble in the body, and typically that's what it treats. So for example, with PCOS patients, we talk a lot about cutting out those damp causing foods, such as fried foods, dairy products, red meats. A lot of those can definitely contribute to these types of symptoms. So I do check the tongue and the pulse in Chinese medicine. Both of those tools are essentially maps of your internal organs, and it helps me to figure out where is that imbalance happening. I could have 5 women here with PCOS, and they could all have a different imbalance, and that's why they're experiencing the symptoms they have. So Yeah, we do a lot of damp draining acupuncture points as well, and focusing on the diet.
Absolutely. So yeah, so that's definitely a big one. Yeah, IVF. So right, that's another big topic we got to hit, because that's a lot of what we see in our practice are both women and men coming in trying to get pregnant, either going through the steps of IVF or getting ready to undergo. They have an appointment on the schedule, but it's not for a few months. And with functional medicine, unfortunately, there's only a limited amount of things that we can do. It's mostly nutrition, and usually I will refer out to one of our clinical nutritionists on our team as well. Nutrition support, once again, we use blood work, see where the nutritional imbalances lie. Make sure there, with inflammation in the body, how can we work to bring that down so that way IVF can go as smoothly as possible. There aren't a lot of herbs that have been studied during pregnancy or during IVF. So generally I like to err on the side of caution. Even though I love my herbs, I love recommending herbs, I'd rather be safe than sorry as far as that's concerned. So nutrition and inflammation support are what I'm here for. But anytime I have a patient coming in who's trying to get pregnant, first thing I will do is I will send her across the hall over to Drenna.
Yeah, IVF is definitely a big part of my practice. I would say, I don't know the percentage, but I would say at least 50 to 60% of my patients are IVF patients. And Chinese medicine is really unique in that it's able to support the cycles that are being created by the medications used for IVF. As well as helping to mitigate any kind of side effects that a lot of our patients get from these medications. And then another part that I really love with treating IVF patients is educating them on the importance of our emotions. In Chinese medicine, each one of our organs has an emotion associated with it. And the two main organs with IVF treatments that are involved, at least from a Chinese medicine perspective, are the heart and the uterus. And the emotion of the heart is joy. And so I always am doing a lot of work with my patients to help them find just a little piece of joy in every day, so that they're not so caught up with the timing of the medications and when do they need to get back to the fertility clinic and what test is being done next. There's a lot of things that they have to keep track of. And so it can be easy to lose track of our joy. So that's a really fun part about treating IVF for sure.
Yeah. Definitely no two cases are alike with that either, which is keeps us on our toes pretty nicely, I would say.
Yeah. I remember speaking with a patient about some research that they found in regards to watching puppy videos or getting puppies, getting a dog, forgetting about the rest of the journey and finding something that brings a lot of joy. And then what do you know? You'll get pregnant.
Imagine that, right?
Yeah.
That's
I think
awesome.
we actually had that conversation too, Dr. Todd.
We did. Yeah. All about joy, all about those puppies. So definitely. Right? Okay. So that's totally a big one. Painful periods, heavy periods, right? That's yes. And that's something that I also am really liking that there are a lot more women coming into our offices now, realizing that having a super heavy period or a super painful period or having a period that knocks them out for like a week every single month, they don't have to have that while ideally a period should just kind of be a minor inconvenience. Obviously in real life, it doesn't always work that way, but that's something that we strive to help out with to make it as minor of an inconvenience as possible. So heavy and painful periods, those are oftentimes the big thing that I'll look at is looking at inflammation in the body. Is it coming from the foods that the patient's eating? Is it coming from the things that they are using either on personal care products or what they're keeping their food in, heating things up in? Are there a lot of plastics or is it more clean? Like glass containers. Also, detoxing out the liver is a really big one. Estrogens, and oftentimes in excess of estrogens, those can get kind of clogged up in the liver. And so bringing in cruciferous vegetables like your broccoli, cauliflower, kale, Brussels sprouts, the things that usually most people kind of skip over, you know, in favor of something different, are very, very helpful in helping to detox out the liver. And then bringing in some herbs, whether it's an excess of estrogen or maybe a deficiency of progesterone, seeing if there's one part of the cycle that's worse than another part of the cycle, kind of leading up to that period, and then trying to mitigate inflammation even before bleeding starts, oftentimes and the timing of it will make a really, really big difference for women in their periods. The only downside with treating anything hormonal is we have to give it at least 3 cycles to see if it's, you know, what major improvements will last. But at the same time, oftentimes the patient is very rewarded, just because after, you know, the first cycle, okay, a little bit of improvement, but then as they keep going, it continues to get better and better.
Yeah. I definitely find some magic behind the 3-month protocol. In regards to treating the menstrual cycle, and specifically with a lot of pain during our cycle. I'll ask whether or not this pain is more present before we start our cycle, during the cycle, or even sometimes it can be very painful after the cycle is done. And each one of those symptoms are present as a different pattern in Chinese medicine. And so, like I've mentioned with those other conditions, we could have 6 people in here who all have very painful periods, whether that's coming from a stagnation of the blood where it's not flowing properly. We would want to talk about different acupuncture points that can get that blood flowing smoothly, different foods that we can start eating that can help smooth out the blood as well. But sometimes we'll find that not only do if the cramps happen after our cycle is done, I would be looking at more of like a blood deficiency. So what can we do for the patient to help build up more blood in the body for the next cycle so that we can see what kind of changes will happen there? But yeah, it's definitely a very common thing that women come in for. It responds really well to acupuncture, and I'll typically utilize a formula or 2 as well. Of some Chinese herbs in there.
And then along those same lines too, we do a lot of support with women who've decided that they want to either stop taking hormonal birth control or for whatever reason it may be, and also kind of helping to detox out the excess hormones, help to regulate cycles a little bit better. Which that too, once again, detoxing out the liver and functional medicine, bringing in those cruciferous vegetables, bringing in a lot of really good vitamins and nutrients, B vitamins specifically, vitamin B12 and folate. Hormonal birth control decimates it, and that can really play into energy and mood and stress response, as well as oftentimes looking at the gut and digestion, because hormonal birth control can also have an effect on digestion because it can kill off good bacteria and allow an infection to take place in certain instances. And then also bringing in some herbs to help regulate. There's certain herbs that work best the first half of a woman's cycle versus, you know, day 1 through about 15 or 16, versus some other herbs that work better from day 16 or 17 to about day 28 or whenever bleeding starts. So that's also recently has been another big part of my practice. And that's also something that I always will refer across the hall to Drenna with as well.
Yeah. Regulating the cycle is huge. And we have so many patients that are either coming off of birth control or starting birth control, and realize that it does interfere with that convenience of regularity. So it's fun to educate my patients about what is a regular cycle. I'll have somebody come in saying, you know, it's regular. It's been every 23 days for my entire life. Well, actually, that's not a regular cycle. It's too short. And what we'll find after the first treatment, oftentimes with the second treatment, our period will extend. Ideally, we want it to be anywhere between 28 and 31 days is actually what a regular cycle is. And so we do like to work with the patient for at least 3 months when we're coming off of birth control to really help get that cycle regulated. Not to say that it can take 3 months to do that. We typically see it happen within that first month. But to be able to sustain those changes, we want to have an ongoing treatment protocol in place for helping to regulate the cycle, as well as a lot of Eastern nutrition advice there too. We can develop some sort of stagnation or some sort of deficiency with our blood and our body's ability to regulate the menstruation. Lots of foods that I incorporate for this would be things that look like blood or that are dark red or purple in color. So that's a one fun part about Chinese nutrition. It's pretty simple and eye-opening.
Simpler the better, right?
Mm-hmm.
Yeah. And then I would say probably the last big thing that we see women's health-wise is supporting women through perimenopause, into menopause, postmenopausal as well. So I do have quite a large part of my patient practice, right, or population right now that are coming into me. They're experiencing hot flashes or brain fog. Weight gain is really, quite honestly, the biggest one. And a lot of women will come to me and they'll be like, I've everything that I've been trying to do. I'm trying to lose all this, this weight, that I'm trying all the methods I've tried before and nothing's working. And that's generally when we do a big dive or a deep dive into their hormones in the history, ask when other women in their families went into menopause. And it's actually become rather clear to me that most of us, we don't have that conversation with our families. And hopefully now that will become more and more of an open topic of conversation because it is important. And so for hot flashes and brain fog, there's oftentimes different herbs and different nutrient deficiencies, to be correct, that can help with that. Weight loss, especially when it comes to perimenopausal weight loss, when it's because of a deficiency in either testosterone or estrogen, progesterone, something like that. That's something oftentimes I will refer out. I will help to kind of build the baseline with nutrition and with exercise and with all of that inflammation, but generally will often refer out. I have a few doctors who specialize in bioidentical hormone replacement. And there's only so much I can do as far as that's concerned, but I can kind of set the stage and then co-manage and kind of pass on the torch, so to speak, with this MD who does fabulous, these MDs that do fabulous work to kind of take it a step further and help the patients, and go through a consult and work up their hormones even further. And then if it's something that's, a little bit more minor, that oftentimes does respond pretty well to functional medicine, but isn't quite to the point where I need to refer out to an MD. Also refer over to Drenna because she can also do a lot to help with perimenopause and menopause.
Yeah. I bet some of you have heard of Yin and Yang. These two things are actually very important when women are approaching perimenopause and menopause. We tend to get an imbalance of yin and yang in the body, and simply that means fluids and the cooling agent and the heat and the warming agent. And so a lot of those symptoms that women experience, such as hot flashes and night sweats, brain fog, fatigue, are all related to that imbalance of yin and yang. So at nighttime, it's yin time. Daytime is yang time. And so I get to educate my patients about, okay, so at night, my yang should be resting because it's not daytime, and my yin should be housing that yang, supporting that yang. But when we're approaching perimenopause and menopause, oftentimes we have what would be called a yin deficiency or fluid deficiency. And so at night, we'll experience a lot of night sweats, irritability, kicking off the blankets, not being able to sleep soundly. And that's simply just because our yang no longer has a house to sleep in at night. And so we get to utilize a lot of really great acupuncture points that help to build the yin or the fluid in the body and to help support the yang during that time as well. And actually menopause, perimenopause are something that I really enjoy utilizing herbal formulas with as well, not only to help with the sleep, the fatigue, the brain fog, but also to help with those other types of symptoms such as irritability, night sweats, hot flashes, those types of things. So it's definitely a big thing that we treat and we see respond really well with acupuncture and herbs. Yeah.
Mm-hmm. Yeah, so I would say those are probably the biggest female health issues that we see and that we treat both in our respective practices and refer across to each other.
Yep.
Wonderful. Thank you both so much for giving us a little bit of an overview on each of those conditions and concerns and how you might treat them. I would like to go ahead and open the conversation up to questions now. Folks, you can type in your questions to the Q&A feature on Zoom, and we'll be very happy to have Dr. Toth and Drenna address them. As you do go ahead and type those in, we just wanted to remind you that Aligned Modern Health is here for you. If you have any questions that you might not like to address in front of a group, but maybe is something more personal to you, you can always schedule a free 15-minute consultation, either in clinic or via telemedicine, and speak one-on-one with a provider that is most equipped to handle those questions. You can give us a call at 773-692-6700, or you are very welcome to visit us at alignedmodernhealth.com. We are in network with most major insurance providers, and we would be happy to check your benefits to see what kind of coverage you may have for treatment with us. I do see a few questions populating here, and I'll be very happy to address. The first one we just touched on actually just now with Drenna. The question is, what can be causing overly excessive sweating in post-menopause non-diabetic women? You did touch on a little bit with the yin and the yang conversation regarding sweat. Is there anything that either of you would like to add specifically post-menopause that might be helpful in understanding what's causing it or possibly how we can treat it?
Sure. So generally, at least in functional medicine, it can be due to just an estrogen deficiency or low estrogen. And that's generally something where saliva testing would be the most, or urine testing is, if I were to, if that were a patient walking into my office, that would generally be the first thing that I would do to see, is estrogen dropping too low throughout the month, and where in the month is that happening? Is it happening constantly? Where's progesterone at? What is testosterone doing? With that too, that is something where there are certain things that I can help with, but oftentimes if it's to the point where the herbs that I've utilized, we've exhausted and there hasn't really been much improvement, I would refer out to one of my colleagues for a bioidentical hormone replacement consultation to see if this patient is indeed a good candidate for that, because that oftentimes can make all the difference as far as night sweats are concerned.
Yeah. And from my perspective as well, with that excess yin and yang, I do want to just clarify so that we can have a better understanding. Like yin is basically like estrogen, yang is basically like progesterone in the body. So definitely we would see like some yin deficiency, estrogen deficiency, and what can we do to build that back up through herbs and different acupuncture points.
Wonderful. Thank you both so much. We have another question here. What could be the cause of consistent headaches the week before the start of a period and potentially some treatment for it?
Oh yeah, that's a big one. So that one is generally estrogen will drop very sharply. It's supposed to kind of ease its way down before the period starts, but for some women it drops really sharply, and that's where those menstrual migraines start to come in. So that's something I refer quite a few patients to acupuncture for that. I've found, at least in my practice, the one nutrient I'll run is vitamin E. Vitamin E is a really big one, at least in hormone functioning, especially around the period, bringing that up to par, as well as utilizing some herbs the last half of the patient cycle. So that way estrogen and progesterone don't crash down estrogen specifically. So that's a little bit about how I would treat that. However, we have to do a very thorough workup. Every case is a little bit different, but that's generally the most common approach when they come into my office. And then, like I said, I send them over to acupuncture, and that's an ideal co-management case.
Oh yeah. Headaches before the cycle are very common. They're not normal and they're not fun, but it's definitely something that I do treat in the office. And usually what we're finding where those could be coming from is either a stagnation in the blood. So it's just not flowing as it should be right before we're starting, which can cause those headaches or rise in heat into the head. But also too, it can be caused from a deficiency of yin. And so a lot of my biggest recommendation actually for consistent headaches, and if it's migraine type, are sweet potatoes or yams. And I'm sure Dr. Todd can attest to the power of sweet potatoes and yams and their ability to help level out our estrogen levels. So definitely can be treated with acupuncture and herbs and dietary changes.
Thank you for answering that question. We have a guest with a family member that has had her period since the age of 12, but it's still not regular at almost 17 years old. It can skip months at a time, and when she does get it, it can last an extended period of time up to or over 2 weeks. Is there something for our younger patients? Do you treat younger patients? Is this something that you think you might be able to help with?
This is generally, at least personally, I generally treat patients over the age of 13. Pediatric patients are not really my specialty. Here and there, depending on the case, I'll take them. But yes, and that's something that's not unusual at all. The big things we would delve deeper into would be definitely nutrient status, would be what is the status of exercise? Is there really heavy exercise certain months and maybe not so much other months? What types of personal care products is this patient using? Are there a lot of what we call endocrine disruptors in there, which means a lot of chemicals that can go in and act as estrogens or block estrogens or otherwise change up what estrogen, progesterone, testosterone are doing in the body, and also look at inflammation in the body, that all those different things that I listed before could all be playing a part in, as well as maybe we need to detox the liver a little bit, bring in some more vegetables, some more cruciferous vegetables specifically, maybe some antioxidants, and then if indicated, if we need to, possibly some herbs as well to try to regulate the cycle for a few months and then ease off of them and see if the brain, ovaries, thyroid, all those different organs continue to talk to each other going forward. So that way the patient's cycle is regulated longer term.
Yeah. From a Chinese medicine perspective, regulating the cycle is definitely something that responds very well with needles. However, that's usually a time when I would most definitely cross referral with Dr. Todd to do some lab work, just to check hormone levels and other things like that to see what's going on with the diet, lifestyle, other types of habits like that too. But it is something that we've seen before, and acupuncture can help regulate.
Thank you both. We have several questions here that are overlapping that several guests have asked similar questions that I just want to address kind of generally speaking. There are several questions here about specific foods, nutrition, diet trends, and that kind of thing that can benefit some women's health concerns. For something like that, we would recommend scheduling a free 15-minute consultation so you can have a one-on-one conversation with a provider, because people's nutritional needs can be very unique to them. We don't like to give too many universal answers to topics or questions like that, only because what's something nutritionally correct for one person can be detrimental to another person. So for those questions, asking about specific foods, specific diet trends, specific foods to remove, we would recommend that you have an individual personal conversation. We also have several questions here about our locations. Our brick and mortar locations are all in the Chicagoland area. You can learn more about each of those on alignedmodernhealth.com, and at the top, click on locations. We are also licensed to treat via telemedicine for our functional medicine and nutrition practice in 8 U.S. states. That includes Illinois, Colorado, Missouri, Arkansas, Washington, Ohio, and Florida. That is also on our website. If you're outside of that area, and I see that a few of you are, we would definitely recommend looking up providers that are well credentialed. You always want to make sure that your acupuncturist is licensed and has specific training in that practice, and not a multi-service provider that may have gotten a certification over a weekend. We definitely suggest looking into folks' educational backgrounds and training. We do have a few more questions here. We can probably take one or two more. And then again, if we have not addressed your question in the time we have allotted for this presentation, you are always welcome to schedule that free consult as a follow-up. One question here I think is really interesting. Can we help male infertility? Do we work with both men and women on the fertility journey?
Most definitely. Like I mentioned a little bit earlier, in terms of yin and yang are similar to estrogen and progesterone and testosterone. So a lot of times when a male is coming in for an infertility, it's most commonly due to low testosterone levels. And so in that case, we do utilize a lot of acupuncture points and treatments that help to build the yang, build the energy in the body, and regulating those hormones as well. So yeah, we definitely do treat male infertility. Women, we must remember we're not the only ones in the journey.
Yeah, absolutely. Male infertility is not, unfortunately, in one of my areas of expertise. However, we have multiple functional medicine practitioners on our staff, and that would be something that if I've had a few patients schedule consults with me for that, and I refer them to one of my colleagues who's much better suited for that sort of thing. Female hormones are more so my area of expertise, but there are plenty of practitioners on our staff that are very well equipped to help treat male infertility.
Thank you both so much, Drenna and Dr. Todd, for joining us today. That does bring us to the time we have allotted for today's presentation. We apologize we haven't gotten to every question, but again, if you do have remaining questions, you are always welcome to reach out to us. We'd be very happy to answer them in a one-on-one consultation for you. Thank you so much for joining us today. Our next digital doc presentation will be on Wednesday, May 11th, and the topic is navigating food sensitivities, allergies, and intolerances. And you can register for that at alignedmodernhealth.com. Thank you again so much for joining us today. We appreciate your time and we hope you found this session helpful. Have a great day.